Hello and welcome to The Explainer. Today, we're pulling back the curtain on what really happens after a regenerative gynecological treatment. We're going to break down that whole healing process so you feel confident and know exactly what to expect.
So if you're thinking about one of these wellness treatments, I bet the number one thing on your mind is the recovery,
for so many of us, intimacy
right?
can get
What's
tangled
normal,
up
what's
with anxiety
not so
and
normal.
pain.
Well, that's exactly what this explainer
For
is for.
so many of us,
to give you those clear, straightforward answers
can
you're
get
looking
tangled
for.
up with anxiety
And the best
and
part
pain.
is, you don't have to figure this out on your own. We're going to walk through this entire process together, and we'll be guided by the expertise of a real leader in women's health. Our expert guide for today is none other than Dr. Farzana Khan from the Women's Health Clinic. Every single piece of information we're about to cover comes directly from her medically reviewed clinical guidance, so you know you're getting the good stuff. And when we say expert, we really mean it. Dr. Khan's experience is just, wow. She earned her medical degree way back in 2003 and has been specializing in women's health ever since. And get this, she doesn't just treat patients, she actually trains other doctors for some of the top regenerative tech companies out there. So yeah, I'd say we're in pretty capable hands. Okay, so let's get into it. Let's talk about the science. How do these treatments actually work, and what does that really mean for your body's healing journey? You know, at their very core, these treatments work by creating something called a controlled micro-injury. Now, I know that sounds a little intense, but it's actually a really precise way to basically wake up your body's own repair crew. It's like giving it a little nudge to say, hey, time to get to work. And that process is what stimulates new collagen and improves blood flow, which is the whole point of the treatment.
So, now that we kind of get the why behind what's happening inside your body, let's talk about what a totally normal, healthy recovery actually looks and feels like in those first few days.
It's really common to experience some mild and this is the key word, temporary effects. We're talking about things like a bit of localized swelling, maybe some tenderness, some light spotting, or even a temporary increase in discharge are all super common. You might even get some mild period-like cramping. These are all typical responses, and they almost always clear up on their own in about 2 to 5 days. And here is the single most important thing to remember about all of that. Those symptoms, they are not something to worry about. Believe it or not, they're actually positive signs that the treatment is doing its job. It's just your body's natural healing process kicking into high gear to renew that tissue. It's a good thing. Okay, but, and this is just as important, you absolutely need to know the difference between those normal signs of healing and the red flags that mean you need to get help right away.
So let's put them side by side so it's crystal clear. A little bit of tenderness is normal. Severe pain that just keeps getting worse, that's not. Light spotting is totally okay. But heavy bleeding, like soaking a pad in an hour, that's a red flag. Same goes for discharge. If it becomes foul-smelling or a weird color, or if you get a fever or chills, it is absolutely time to call your clinician.
And, speaking of fever, here is a number to remember. 38 degrees Celsius, which is 104 Fahrenheit. If your temperature hits that mark, that's a really key sign of a potential infection, and it's your signal to get a medical review, no questions asked. Dr. Khan also points out this really simple but brilliant rule of thumb she calls the Day 3 rule. Basically, if your pain was getting better, but then all of a sudden it comes back or it gets worse a few days later, that's a classic red flag for an infection. Don't just sit there and hope it gets better. That's your cue to get a medical assessment.
But what if the signs feel, well, much more severe than that? Now, while it is incredibly rare, it is so important to know the symptoms of a serious complication like sepsis.
These are what's known as the sepsis 6, and listen, this is an absolute emergency. If you or anyone you know has any of these symptoms after a procedure, slurred speech, extreme shivering, no urine for a whole day, trouble breathing, weirdly mottled skin, or that terrifying feeling of doom, you call 999 or you go straight to A&E. No hesitation.
I really want to pause on that last point for a second. That feeling of, I might die, that's not just you being dramatic or panicking. That is a clinically recognized symptom of sepsis. Your body has this incredible primal way of knowing when something is catastrophically wrong. Trust that feeling. Act on it immediately. All right, knowing the warning signs is half the battle, for sure. But now let's shift gears and talk about taking control. Let's talk about the proactive steps you can take at home to make sure your recovery is as smooth and comfortable as possible. Your at-home care plan is actually pretty simple, but it's super effective. First things first, for the first 48 hours, just rest. Take it easy. You can use a wrapped cold pack, externally of course, to help with any swelling. Drink lots and lots of water and stick to breathable cotton underwear. And this is a big one. Avoid putting anything in the vagina. No tampons, no intercourse, and stay out of pools and baths for the time your doctor recommends, which is usually about 3 to 7 days.
Let's do a quick little do's and don'ts list. Do use pads for any discharge. Do take simple painkillers like paracetamol per mild discomfort. And definitely do keep an eye on your symptoms. But please, don't use tampons, don't take leftover antibiotics just in case, and don't use any perfumed soaps or products down there. And maybe the most important don't of all, don't hesitate to call your clinician if you're worried about anything. That's what they're there for.
You know, when you boil it all down, all this information really serves one main purpose: to empower you. Being an informed, active partner in your own healthcare journey is truly the best way to make sure you have a safe and successful outcome.
So, we'll leave you with this to think about. Now that you know how to tell the difference between what's a totally normal part of healing and what's a serious red flag, how does that change the way you prepare for and approach your own wellness journey? Hopefully, it makes you feel a whole lot more in control.